In ABA, we use lots of different assessments to know where our learners' strengths are and what areas they might need more help in. So what are the most common ABA assessments, and how do we know which one to use for our learners? Hi, I'm Shira.
And I'm Shayna. We're behavior analysts that create weekly content about how to teach children with autism so that they make real progress. And we create shareable resources to make your job just a little easier. Today's topic is all about ABA assessments. And if you want more videos like this, make sure to subscribe and hit the notification bell to stay updated on new video releases.
So really the purpose of assessments is to give you a starting point. So if any of you have done any kind of diet or exercise training, if you think about what that process is, before you start anything, before you change your diet or change your lifestyle, you're going to get weighed and measured and get all the details of everything that you're currently doing in terms of food, nutrition, and exercise. And then they're going to start implementing the program, whether that's nutrition, lifestyle, exercise, all those different components. And then you're going to have ongoing check-ins. So the goal of the assessment is to give you a baseline. It's a point of reference to know, where am I starting from before any kind of intervention, which is similar to VA. We want to know where our student is at. And then you take a step back and you look at the big picture. So similar to diet and lifestyle, what's the big picture? What is this individual's lifestyle like? What is their day like? What are their goals? How much time do they have? What do they like to eat? What do they not like to eat? And then you try to help them meet their goals based on those criteria. And you continue to measure progress through continuing to assess. And that's similar to what we do in ABA. We want to know where our students are at, and then we look at their big picture and think about what their goals are and what they need to meet those goals, and then continue to assess progress through using these assessments.
So as behavior analysts, we are taught first always do an assessment with your student. Lots of times I'll go into programs and I'll take a look at their curriculum, and I'll see that their curriculum is really just trying to fill in boxes from the assessments they've done. And I can't stress this enough, assessments are not curriculum. Can I say that again? Assessments are not curriculum. Please don't teach to assessments. When we teach to assessments, we get real cookie cutter programs. And then, the criticism about ABA makes kids like robots is kind of true, right? Like if we're just trying to fill in boxes on an assessment, we're not individualizing programs, and that's really not ABA, or not good ABA anyways. So really, if you can think of assessments being a baseline and then being a measurement and good progress marker, and it's not curriculum, that would be your best takeaway from this whole podcast. We have done a whole CE assessments and this topic, not necessarily just teaching to assessments or not teaching to assessments, but also breaking down which assessments are which and which learners to teach and everything else. This podcast is going to be a really quick overview of that, just because we get a lot of questions about, well, I've got this type of learner, what kind of assessment do I do with them? And, have you heard of this assessment? Well, what's this one all about? Who do I use it with? So if you want more on this, check out our membership with the webinar. We've got a webinar included with the membership, and the webinar is called All About Assessment. So check that out. But like I said, listen to this first. It's an abbreviated version.
We also did a podcast recently for the Autism Helper all about assessments, with us talking about how assessments don't have to really be so overwhelming. They don't have to be as cumbersome and scary as we think that they are. It could often just be, a simple checklist or some way that you can track progress, because that's our goal. And we are going to break down the most common assessments used so that it's not so overwhelming and you understand the differences between them. There is no one size fits all assessment. There's no one size fits all programming. So just kind of keeping your learners in mind and the individualization of those goals.
So as an ABA therapist, as an ABA professional, we probably hear, some of the most common assessments, right? So terms thrown out like ABLLS, VB Mapp, those ones I would say are the most common. Then you've got something like the ESDM, which is Early Start Denver model, which is also, a pretty common assessment for young kids. And then we have a PEAK by Mark Dixon. We've got the AFLLS. How to ABA has even done their own assessments. So you've got a whole bunch of different assessments. Other assessments might include, the Vineland or other psych assessments, speech language assessments. But let's talk about the most common ones. Let's talk about the ABLLS and VB Mapp first, and maybe compare and contrast them, and who do we use them for.
Yeah, so starting with the ABLLS, which is two L's, one B, for those who make that common mistake.
Assessment of Basic Language and Learning Skills.
Yes, that's what it stands for. It was authored by James Partington. So it was one of the, original assessments, and it was looking at language across operands. So it's not just enough to talk about language as a whole, but it's important to talk about what that language looks like and how the learner is using language. So the whole first page of the ABLLS, or almost the whole first page, is about the different language operands. So manding versus tacting versus following instructions, intraverbals, all of those different ways that a child uses language. It also goes into a section on motor skills, self-help, some academics. It's very comprehensive. There is a lot. If you were to scan through the whole ABLLS with a learner, it would take you a really, really long time. I would say the good age range to start using an ABLLS with a learner is probably around 4. It doesn't focus on anything developmentally. So while it has some play skills and social skills and things like that, it's not in any progression of skills that you should be looking at from a developmental perspective. So very often we might see somebody implementing, language scale for a 4-year-old that's not even really developmentally appropriate, but the ABLLS wouldn't tell you that either way. So you do have to use your own discretion in choosing some of those areas from the ABLLS. It's not great for a play-based program. It's really more for, I would say, like a DTT style program where the learner is really working on language goals. So a lot of receptive idea and matching and tacting and teaching across operands, which is a lot of our programming for those, I would say 4 to 10-year-old learners who are really progressing through language, through conversation and requesting and manding and answering questions and all that stuff. Usually if a learner is using an ABLLS assessment, or we're doing the assessment on them, we would never go through the entire ABLLS and test them on every box. Sounds painful to me. I can't imagine my little 4-year-old client having to go through every one of those boxes. What we'll do is we'll kind of get to know the learner a little bit, work with them a little bit, start some shell of a program. So if we have met the learner and we know that they need to work on receptive language, like we're going to start baselining those programs. And that will be the first few weeks. And then based on what we know of the learner, we're going to fill in an ABLLS assessment on our own. It's not going to be tested and probed through each one of those boxes. If we have a question that we really don't know if the learner can do this or not, sometimes in the H section that would come up, then we might bring that to the learner and probe a couple things. But we're not looking for even 100% accuracy on these assessments. We're looking for like a good judge of where this learner is at based on my understanding of this learner, based on what they've shown me in the last few weeks of me getting to know them. It doesn't have to be 100% accurate, because that will just be, a waste of time and frustration for the learner. Also, technically, you're not supposed to be incorporating reinforcement during like an assessment. So can you imagine why would this learner want to respond to your question after question after question throughout this ABLLS assessment, which is super comprehensive? You also don't have to do all 3 pages of the ABLLS. You could pick a section and just use maybe the first page because you're focusing on language, or just pick the school readiness section because you're focusing on those skills. It doesn't have to be all or nothing. Really use your discretion in whether this is the right programming style for your learner, if you're focusing on the type of goals that the ABLLS talks about. But then once you've completed the ABLLS, you're going to put it down. You're going to leave it. You're not going to pull programs out and focus on B12 of the ABLLS section. You're going to put it away. You're going to take out, your program planning matrix, and you're going to look at your learner as a whole and think about, based on where they're scoring on the ABLLS, they may need some, programs that focus on receptive language. And then they might need some programs that focus on following instructions or manding or whatever that is. And then you're going to create a program based on what picture that gave you of the learner.
So, Shira, you mentioned that you shouldn't be using the ABLLS assessment or have it like a big comprehensive 2-month long, let's do an ABLLS assessment. And I've actually gone in and seen some programs like that, and I go, oh, because the poor learner, like I couldn't even imagine. Likewise, you don't want to be doing an assessment if you're not paired with the student, right? Because that's the other thing, is that even if you do try and, look and test every little thing on an ABLLS assessment or any assessment, and you're not paired with the student, you're not going to get the right results anyways. Once you're paired and once the student's opened up to you, then you can go and you can, probe a few more things because the learner is more comfortable with you. But moving on to the VBMap. So VBMap is called the Verbal Behavior Milestones Assessment and Placement Program. That's what it stands for. It's by Mark Sundberg, and Mark Sundberg was actually an author on the first edition of the ABLLS. And then the second edition of the ABLLS came out and it was just James Partington, and Mark Sundberg was doing his own thing and he did the VBMap. And there's pros and cons to the VBMap, but what I really love about it is that it's age normed. So like the ABLLS, it does go across different operants and it does break down language according to, listener, receptive, and tacting and manding, and it goes into some group work and things like that as well. But it goes up to specific ages. So Mark Sundberg has, one level that's 0 to 18 months old. And, he's saying that, you don't want kids who are, in really high levels of one thing and really low levels of another. You really want to get that one level solid. And then you want to move up to the next level and then to the next level. So the VBMap is age normed up to 48 months. Now, you've got some learners, obviously, who aren't, presenting at a 48-month-old level. So, you can use the VBMap, when a child's older than 4, but typically, we typically use the VBMap when a child's usually between the ages of like 2 and 6 or 7. You don't really want to be using it beyond then because, Mark Sundberg talks about play skills, for instance. And, a 10-year-old's play skills are very different than a 2-year-old's play skills or a 3-year-old's play skills. So even though it's age normed, it may not be an appropriate assessment for an older learner. But the VBMap is great in terms of that, teaching across, or not teaching, sorry, assessing across operants and just having that basis for age norm, like, oh, this is what's appropriate for this age and this is what's not appropriate. It goes across different things as well. So not only does it teach, and I keep saying teach and Shira's face goes, no, you don't want to teach across assessments, but it does, look at various things. So it does do an assessment across operants. But it also gets into other things like transitional barriers, right? So it talks about barriers to learning. So, if your student may not have, much more going on after 6 months and you've retested them and the assessment's gone nowhere, you could look at the assessment or the barriers, and those barriers could be things like, poor motivation, difficult behavior, a whole bunch of different things on there. It also has a section on transitions, right? So transition to other environments and generalization. So it probes that and it gives you areas to look at and just some things that you could be putting into an IEP.
Yeah, so we often get a question, I have a 10-year-old learner who's still in level 1 of the VBMap. So what should I do? And then it's like, move off of the VBMap. Like, that's probably not the best way to assess a 10-year-old. You might be moving into like an ESL type assessment or something that would be more appropriate. Again, you're not teaching to any of these assessments, but it would give you a better picture of where this student should be if they're 10 at a type of level 1 VBMap. Another more recently common assessment is called the ESDM, or the Early Start Denver model. This was created out of UC Davis. And it was really focused on little kids, and it's focused on the developmental progression of how young kids learn, also across different areas. Most of those areas, though, are social and play. It's not a lot on those, like, there is a section called cognitive skills, but it's not a lot on the like pre-academic skills. It's not going to take a learner into any much language school type programming. It's really focused on building the pivotal skills that will allow a learner to learn in a classroom. So if they can attend and follow a point and notice the adults around them, then obviously if they're 4 years old and going into a classroom, that they would be a lot more successful versus having to teach them shapes and numbers and colors. Even though it does incorporate a small section for that, that's not the bulk of it. So it's good for learners who are still in that, 2 to 4 year, even less than 2, I would say it's the first level is 18 months. So up to 18 months is the first level, and then it goes up to 24 months, 36 months. And it's for those learners within those age ranges who really have the potential to learn these pivotal skills through, often through play, through a very natural style of learning. It breaks down the goals in those sections in play and social a little bit more than the VBMap, but I would say that it would go until about 4 years old. At that point, the learner is past a lot of those developmental phases of what you'd be working on at a 2 and 3 year old level. And you may want to bring them into more of an ABLE style programming. If they're still struggling with those skills that they're not being able to learn naturally at that point, they need more of the discrete instruction, then you may move towards a more discrete style programming and assessment, which is like the ABLLS VBMap type.
I have to say, I love the ESDM for those super early learners. I used to get kids into my clinic who, would score almost 0 on an ABLLS or a VBMap. And you're thinking, oh, where do I go from here? What do I do? And, for those learners who are scoring almost 0, you can't even show that assessment to parents because it's heartbreaking. But something like the ESDM will go and pick apart some of those really, really early skills, like Shira mentioned, right? The joint attention, following a point, all of those kinds of things. So it's nice from, our standpoint going, oh, okay, this gives us some guidance and this gives us some ideas of where to start teaching, but also from a parent perspective going, okay, my kid does have a few things and this is great. There are some things that can be worked on.
And it's also not overwhelming to complete. It's like a nice checklist, and it doesn't, if you've decided that your learner is in the 12 to 24 months, range, and you're looking at that programming, that's all you really have to complete as the checklist. One of the things that, I don't love seeing is when BCBAs spend time outsourcing these kind of assessments to the RBTs or the ABA therapists when they're not really trained to do it. And they're taking so much time of the session, not really knowing what they're looking for, and not really knowing how to complete these kind of assessments, when the BCBA could sit in on a session and complete an ESDM checklist in 20 minutes. So thinking about like the role of the RBT within this conversation of where they can help you and support you in some of these assessment goals, but it's really not within their job to be fully given an assessment and say, here, do the ABLLS assessment. So I really think we have to use a lot of discretion as BCBAs as to like, what are we responsible for? What is the time? How is the time being spent between the RBT and this learner? And is it, the most effective use of time?
Let's go off topic a little bit, Shira, and just talk about how we do an assessment. When we do an assessment, I typically would sit down with a learner. Usually I'm getting them for the first time, or maybe I've had this, I've worked with this child for a while, but I'm actually going to physically jump in myself and pair myself a little bit, bring some of their favorite activities and play as much as I can, or try and get into their activities. And then I'm just going to try and be fun, because if I'm not fun, they're not going to give me much. For certain learners, I may present some flashcards or some books, but if that's not what they want to do, I'm not going to be doing that during an assessment. There's other ways to get at that. So, my quote unquote assessment period would be, 20 minutes, 30 minutes of, playing with whatever preferred activities that they want to play with, maybe trying to transition over to a few books or some board games. But if they're not into that, that's fine. I can stick with some of their preferred activities. But then setting up situations where I'm like, hey, put that in here. And I'm pointing to certain things to see if they'll follow my point, or, oh, go get that. It's under the blah, 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 to test prepositions. I'll throw comments out to see if they'll comment back, to see if, they'll ask me a question or whether they'll answer some of my WH questions. And then what I'll do is, after that 20 or 30 minutes of play, they go back to the RBT, or they go back to their parents. And, I'm going to be then filling out my assessment in my office, in my car, wherever I am, after that. And then if there's any questions I still have, I'll make a separate cheat sheet and then go back and test the child again. But I'm not filling out the assessment as we go, because I don't want to slow down that assessment period or that process. And I also don't want to bring a pen and a piece of paper into that play, because I think it ruins that interaction. And like Shira said, I'm not going to be outsourcing this to an RBT, because I'm the one who's doing the programming. The RBT isn't. And, if you say to the RBT, can you just test prepositions? The RBT is just going to test prepositions. Whereas when I test prepositions, I'm not only testing prepositions, but I'm also testing the ability to follow my gaze, to follow my point, point to, go from one activity to the next without getting distracted, those kinds of things. So I'm testing so much more, and there's so many subtleties that I'm going to get when I'm interacting with a learner versus outsourcing it to somebody else.
Yes, so true. Okay, we're going to talk a little bit about another style of programming called Peak. Now, this is a bit of an exception to what we say curriculum is assessments are not curriculum. Peak is a curriculum. It does provide a curriculum based on their assessment. It's very specific to like school age children who are working on a lot of language. It's based on the relational frame theory. So if I can teach a learner that A equals B and B equals C, they should learn to derive that A equals C. Is that right?
Okay, Mark Dixon, I relational frame theory and me don't always get along. It's kind of like calculus. But Mark Dixon has a really great analogy in his presentations. If you have never seen a presentation by Mark Dixon, do it. He's great. But he says, hey, has anyone ever heard of an oxalato? And I think more and more people have, but pretend, go with me here. If you don't know what an oxalato is, you're gonna go, And then if I tell you one thing, if I say an oxalato is a Mexican walking fish, just from me telling you that, you can derive a whole bunch of information from that. So now I can ask you questions and say, hey, does an oxalato live in warm weather or cold weather? And you would say, probably warm, because I'm thinking Mexico and I'm deriving that information. Hey, tell me where it lives. Mexico, right? Does it live in water? Does it live in the air? Or does it fly? I'm thinking it's a fish. It's probably water. So you're deriving all of these things off of me just telling you one piece of information.
Right. And so often our programming relies on very discreetly teaching our clients the information that they need. You only know this because I've explicitly taught it to you. And what Peak is relying on is let's teach our kids to learn for themselves, to rely on previous information that they may have learned and be able to derive relationships from that previous information. So it's really working on things like inferencing, complex relationships between language, and it does a lot of like teaching, and then testing. It was created to be done really in a school setting for kids to be able to work on Peak for an hour a day. It doesn't have to be done by an ABA professional. It was created so that anyone in the school system, any teacher or assistant or anyone can run the programming with the individual for an hour a day. And I believe that the studies showed that there was a significant increase in IQ after students working on Peak for about 5 hours a week. So there is a lot of value in this style of programming for kids who need to learn that, going beyond memorizing certain concepts. They have to take it a little bit further, and implementing a Peak style program might help them get that next level of, inferencing and generalization of stuff that they've previously learned. And it's like really learning how to learn.
So typically we would do something like a Peak after, the ABLLS, after VBMap. So, the Peak, you have to have a certain level. You have to be able to answer WH questions. Really, to start that Peak is kind of where you're at. So I wouldn't start a Peak with a 3-year-old.
Yeah. Although there are different ways that they would say they wouldn't start maybe the generalization module. There's different ways to do it, but I think that's really up to the learner and seeing is this the right fit for them, and like, what are the goals of this student?
So we also have a how-to ABA assessment that we've done that kind of combines a bunch of these assessments together. And like we said before, that, when we do our assessments, it's a 20 or 30-minute thing, and then we go and fill out an assessment afterwards. Our how-to ABA assessment really does combine, the ABLLS and the VBMap and a little bit of, some inferencing stuff, but it's really just taken from a quick how-to, for instance, to do assessments. So what I'll do is I'll print off my 6-pager how-to ABA assessment that's broken into beginner, intermediate, and advanced. And then I meet the child for the first time, and if the child is an intermediate learner, I'll just take the intermediate pages and take a look at that, and that's really my cheat sheet for when I'm playing with the student. And then afterwards I'll fill that out, and then I'll fill out the ABLLS or the VBMap or whatever assessment I'm doing, and that's how I do that. Then from there, I also kind of, in addition, I'll be asking parents their goals. And I think that's one thing that we didn't really talk about yet is with assessments, with any assessments I do, we look at baselining, but when I'm starting to do programming, I'm going to be always constantly asking parents, well, what are your goals? Because sure, you know what, the VBMap, the ABLLS may give me an idea of some goals to work on. But if they're not functional for the learner, or they're not functional for the family unit, they're not going to be generalized. So really getting to the parents and saying, hey, what are your goals? Great, based on the assessment that I've just done, based on your goals, then I can put together this program plan.
Yeah, so we've actually made this How to VB assessment available in our free membership because we believe that it really eases so much overwhelm to be able to go into an intake with like a really easy checklist. It doesn't have to be overwhelming and cumbersome, and it's much easier on the client. So go and check that out. The one thing we forgot to mention is also those life skills assessments. They do exist, and there's something called the AFLs for some students, EFL, and it's even more important when using these kind of assessments to not look at them as curriculum. They're great benchmarks, they're a great way to see, but you're never going to be able to work on every area that the AFLs has to offer. So you can't look at it as boxes to be filled in, but it's great to give you some ideas of what to work on with older students who are working on whether it's vocational skills or school skills or home skills. It gives you some really great ideas of what your student can do, and then you're able to track their progression along the assessment as they go.
How could I forget life skills programming? I work with adults now, and how did I forget life skills programming? Like Shira said, these are definitely not tick off the boxes, they need to be done. For instance, I was in an AFLS meeting yesterday with a client, and this client doesn't fold clothes, and she doesn't put away her own clothes, but they have a housekeeper who does that, and it's not one of mom's goals. And, there was a box that said, listen, she can't fold her clothes and she can't put them away. And, we said, well, maybe we can teach her how to do that. And the mom said, not a priority. She will never need to learn how to do that. I don't want her being taught. I thought, good enough. Great. Okay, let's go with family goals here, right? So
we actually have a whole blog on assessments. So go and check that out on our website. It's howtoaba.com/assessments. And we talked about the importance of like pairing and building that relationship before even jumping into any assessment. You don't want to meet a student for the first time and have your ABLLS notebook out and be checking off those boxes. So go check out our blog on pairing and developing that positive relationship first before working on those assessments.
And if you're interested in our How to ABA assessment, it's free. So it's just subscribe to our free membership, and with that free membership you get the How to ABA assessment. We also have the parent intake form there that asks for parent goals, and then we have the program planning document, and we have a whole series of little videos that Shira and I have done in just terms of like, how do you use this, and what's functional here. So go check that out.
So I think we went through a lot of assessments today. At least there's a lot more. We went through the most common ones, and we talked about how you would think about applying each one of those to your learners.
So we're sharing our How to ABA assessment and program planning matrix in our free membership. So click the link in and around this video to join our free membership for those assessments.
To join our free membership and to get access to the How to ABA assessment and program planning matrix, click the link on or around this video or in the description below. We also encourage you to subscribe to the channel so you don't miss any future videos, and leave a like and comment below if you have further questions.